Hi guys, my name is Chris and my group members are Shannon, Catherine, Mel and Jackson. We are doing topic number 2, obesity, which according to the World Health Organization defines as is abnormal or excessive fat accumulation that presents a risk to health and is strongly associated with foot pain, disability and disease. However, obesity isn't just an aesthetic issue, but a contributing cause of musculoskeletal health problems, specifically problematic with the feet and ankles. To demonstrate the relationship between obesity and complications relating to the foot, the National Foot Health Assessment conducted a survey in 2012 which proved a strong negative relationship between obesity and foot health. Results showed that 51% of survey respondents who characterized their foot as being fair or poor reported being obese as well. Pathologies are not just related to the feet, but can affect the entire lower limb, including the hips, knees, ankles, which can therefore cause alterations to the gait cycle. Obesity can cause changes in foot morphology and subsequent impacts on balance and mobility. Excess weight in conjunction to the changes to the foot can also lead to higher foot pressures. These increased foot pressures in the foot can cause elevated plantar pressures during walking and standing, which subsequently causes pain in the forefoot and can predispose the individual to tendonitis, plantar fasciitis, and osteoarthritis. Due to increased BMI, obese patients can be predisposed to sustaining fractures and lower limb injuries. The main foot problems resulting from obesity include heel spurs, arch pain, and heel pain. Pressures placed on the heel can cause foot and ankle problems in a variety of forms, such as osteoarthritis, tendonitis, and plantar fasciitis. Due to the extra weight and pressure being placed on the foot, the arches of the foot can collapse, leading to a host of other foot problems, including a greater tendency for the foot to roll inwards. All of these conditions are serious and can lead to chronic, debilitating pain that may require surgery. Osteoarthritis can be presented by achy joint pain exacerbated by extensive use. Also, reduced range of motion and cracking sounds are frequently present. Stiffness during rest may develop, with morning joint stiffness usually lasting for less than 30 minutes. Foot and ankle tendonitis is a common cause of foot pain, especially in obese adults. It occurs when there is inflammation or irritation of the tendons. Symptoms typically consist of pain, swelling, and stiffness. Early diagnosis and treatment is essential as it usually takes 2 to 3 months to fully recover. However, it can take much longer without the proper treatment. Plantar fasciitis is one of the most common causes of heel pain. Plantar fasciitis is the inflammation of a thick band of tissue called the plantar fascia, which runs along the bottom of your foot, which connects from your heel bone to your toes. Symptoms typically include a stabbing pain in the bottom of your foot near the heel, with the pain usually the worst during the first few steps after awakening. It can also be triggered by long periods of standing or rising from sitting. The pain is usually worse after exercise, not during it. Relevant anatomy. Obesity has a significant effect on an individual's foot structure. Feet, as the body's base of support, continually endure often high ground reaction forces generated during daily activities. The component primarily responsible for absorbing and dissipating these forces are in the feet, along the longitudinal arches. Although these arches comprise of bony articulations, ligaments, and muscles, it is primarily the ligaments that support and stabilize the longitudinal arch. The ligaments supporting these arches include the spring ligament, the deltoid ligament, the short plantar ligament, and the long plantar ligament. Muscles provide secondary support by maintaining the arch during dynamic tasks. Ligaments rarely incur physiological fatigue and therefore offer a great resistance to stress compared to muscles. However, repeated excessive loading that an obese foot may experience may stretch ligaments beyond their elastic limit. This may increase the risk of damaging soft tissues and increasing the risk of foot discomfort. The bones primarily experiencing the foot discomfort include the calcaneus, the talus, the navicular, the cuboid, and the talar heads. Obesity increases the force and weight applied to these longitudinal arches. Thus, the rates of flatter feet are significantly higher in obese individuals compared with healthy individuals. There is an increased risk of higher dynamic pressures under the forefoot in obese individuals. Overall, the pressure due to increased weight mainly affect the longitudinal arches of the feet. So, secondary complications that can occur Obesity has an enormous amount of links and risk factors to many other secondary complications that cause significant damages to the body. Some well-recognized and chronic complications include diabetes mellitus, hypertension, and atherosclerosis. Type 2 diabetes is known as a lifestyle disease, with the main risk factors including carrying out a sedentary lifestyle and being overweight. Type 2 diabetes is where the body is unresponsive to insulin present in the body, this is referred to as insulin resistance or resistant, and result in a buildup of glucose within the blood. Hypertension is defined as having a high blood pressure reading higher than 140 over 90 millimeters of mercury. The World Health Organization suggests that the increasing growth of the processed food industry has greatly impacted diets towards a diet high in salt, which results in weight gain and could possibly lead to obesity. Excess salt is also a contributing factor of hypertension, and if it is poorly managed, can lead to heart attacks or strokes. Atherosclerosis, a chronic disease in which the buildup of plaque forms on artery walls, narrowing the artery and causing potential problems such as hypoxia, gangrene, and necrosis of tissues. Atherosclerosis plaques form when the endothelial layer of the artery is damaged due to an irritant such as an excess amount of LDL lipids and cholesterol. The lipids then stick together and form the plaque. Obesity is very commonly seen in podiatric patients and is highly regarded as a common cause of podiatric problems. According to a paper published by Blixer, more than 66% of obese people develop secondary complications due to obesity. This statistic alone highlights the high morbidity associated with obesity and the large scale of impact it has on daily functioning of patients. The fact that obesity is a multi-pathological disease with a vast list of associated complications explains the wide variety of podiatric complications that are seen by podiatrists. However, as podiatrists, we do not treat the underlying obesity which causes these symptoms. Instead, our domain involves controlling the secondary complications, which can involve osteoarthritis, diabetic foot complications, leg and foot ulcers, tendinopathy, structural foot deformities, plantar fasciitis, peripheral vascular disease, and deep vein thrombosis. Since obesity itself is not within the realm of podiatric influence, obesity is a relatively unimportant issue. The secondary issues caused by obesity, however, are what we mainly aim to treat and resolve. Another reason why obesity may not necessarily be regarded as a main priority for podiatrists is that a lot of complications of obesity are more likely to negatively affect other body systems before affecting the lower limbs. The main aim of these patients from a podiatric perspective is to help them remain functional, to manage their symptoms, and to allow patients to continue their activities of daily living unhindered. As a result, the goals of treatment are usually not targeted at the primary problem of obesity, but rather the secondary symptoms which hinder the patients. Another complication of these obese population is due to their limited range of movement. They may not be able to even touch their toes. This in itself creates more complications due to poor hygiene and lack of foot care. Due to their sedentary lifestyle, they compromise their foot care and prioritize other more life-threatening conditions over obesity. Obesity itself creates many other pathologies in which podiatrists primarily treat. A good podiatrist will not only treat the secondary diseases, but will also try and treat the primary cause of the disease, being obesity.